I'm speaking on the role of genetic counseling and team-based care for inherited heart conditions that predispose to sudden death. I'm a genetic counselor specialized in cardiology, and genetic counseling is a service within cardiology that's really been exploding in the last 5 years in particular. So genetic counselors are master's level trained healthcare professionals who have expertise specifically in genetics as well as psychological counseling. And as genetic testing and the understanding of the genetic basis of inherited heart conditions has increased, the need for genetic counselor services within cardiology has increased as well. A genetic counselor's role is sort of a combination of a certain type of medical expertise as well as psychological counseling expertise. So when I see a family, I'm trying to help them and their physicians understand, is your heart condition hereditary? If it is, what does that mean for your brothers, your sisters, your children, for planning a family in the future? How can genetic testing help us answer some of those questions? We'll take a very extensive family history that sometimes takes 30, 45 minutes to do, going back 3, 4, 5 generations. And then our job is also interpreting the genetic test result, making sure that we and the physicians and the family really know what that finding in their genes means and how to apply it to their care. And then lastly, helping families and individuals to kind of cope with and adapt to the genetic condition in their family and their genetic risk. You're dealing with not only sudden cardiac death, so devastating, coming out of nowhere, lethal, but you're dealing with it in otherwise young, healthy people in these diseases. I mean, some of these conditions, the first thing that we see in the family is a young, healthy person dying suddenly. And that is frightening, it's devastating, it's traumatic. These families have a certain amount of PTSD and very complicated grief. So from a medical standpoint, we start with what we have on the person who died, hopefully a really good autopsy, hopefully the coroner saved DNA that we can do genetic testing on, digging into their medical records, doing detective work, figuring out what a clue might be. Sometimes we can get the answer that way. Other times we have to instead turn to evaluations of the family. Now the family needs to be evaluated just for their own health and safety because this could be running in the genes. But the family evaluations also can often provide a clue to the cause of death of the young person who died suddenly. And if we can get an answer to why that person died suddenly, then we know how to watch the rest of the family, the parents, the other young children, and how to protect them. So fortunately, you can almost always prevent sudden death once you figure out what's happening in the family and who has it. These diseases, we don't have prevention for the vast majority of them, but we do have effective treatment and we have prevention of sudden death. So for instance, if a young person dies suddenly while swimming and then we do an evaluation and we find out that they have an inherited arrhythmia called long QT syndrome, we can identify other members of the family who also have long QT syndrome. We can treat them with medication, avoiding certain medications and activities that increase their risk. And in most cases, that will prevent further sudden deaths. In some cases, we instead have to turn to implanted defibrillators to help prevent sudden death in the surviving family members. So the good news is that if we can get these families the right cardiovascular genetics workup, we can prevent further sudden deaths. We can't prevent the disease, but we can treat it such that we prevent further sudden deaths. Unfortunately, probably most of these families who have a young person die suddenly and could have a genetic disease are not getting the right workup. And there are medical guidelines and expert consensus statements from multiple professional organizations that recommend this kind of evaluation. I think the barriers are several things. One is that the sort of people on the front line, whether it's a medical examiner, a coroner, a pediatrician, a primary care doctor, making sure they have the knowledge that this is a family that needs that specialized care. They don't just need an autopsy and some condolences. They need to be sent to a center that specializes in inherited heart conditions and DNA saved and the right autopsy done on the deceased. So that's one thing. Another thing is, how many inherited disease centers are there out there? And that number is increasing rapidly. It's not where it needs to be yet, but it's growing very, very quickly. And of course, many of these families, if they're not near one of those centers, will travel to see one of our expert centers.